Welcome to the Cleveland Clinic. My name is Kevin Contreras. I'm one of the fifth-year residents, and me and a few of the co-residents will be showing you around campus. We're standing in the 7th floor of the Crowell building, which is home to the Head and Neck Institute. That includes otolaryngology, audiology, speech, and dentistry. We're going to show you around campus and what it might feel like to be a resident here at the Cleveland Clinic. Follow me and I'll show you the campus. We're starting with the Head and Neck Institute. Here we see patients outpatient, which are all adult patients. We also have our audiology centered here and our dentistry, so it's all in one area. This is the check-in area, and you can see we have a beautiful view overlooking Cleveland. We're a half mile from the lake, and just adjacent to us is the brand new medical school, which houses both Case Western Reserve University and Lerner College of Medicine. It also houses oral and maxillofacial surgery, as well as nursing and a few other specialties.
I'm Kevin Liang. I'm one of the second-year residents, and I'd like to welcome you to the Voice Center. If you come with me. So this is where our laryngology staff and our speech-language pathologists see a lot of patients. And right off the bat, you can see along both sides of the wall here are a lot of famous singers, actors, etc. that have been treated at the Voice Center. And over into here is one of our procedure rooms. It's fully stocked with everything you can possibly want for procedures from laryngology, facial plastics, etc. This is one of the main procedure rooms we have on main campus, but in addition, we have a lot of procedure rooms and other clinic spaces at our regional campuses. And around the corner here, this is one of the neater parts of the Voice Center. We have a fully functional sound booth. And further into here, there's a piano, and again, everything is fully soundproof. I actually, on my speech pathology rotation last year, worked with a patient in here with one of our speech pathologists to improve their voice. So now we're walking from the Crowell building toward the main hospital building, and we're passing the Crowell cafeteria, which is a great place to eat. It's one of the many places we have to eat on campus. In here, there's like a grill station, burgers, pasta, pizza. There's also, my favorite, there's a poke station, so fresh salmon, tuna, anything you could want. There's also one of the 3 Starbucks that we have on campus is right here, and it's right downstairs from our clinic space. So it's a quick lunch break, and you can grab anything you want to eat. And then further this way, we're going to enter the Skyway, which will lead us to the rest of the hospital.
Hi, I'm Emily. I'm one of the PGY residents, and I'm going to be showing you around the Tuscon Cancer Center. So we're standing right here in the intake lobby, and as you can see, in addition to being a very beautiful building, this is also one of the nation's few comprehensive cancer centers. In this lobby here, we actually have tea and biscuits once a week for all the patients that come in here, and they're able to see their surgeon as well as their medical oncologist and radiation oncologist all in one appointment, which is very convenient for patients. And they can also get imaging downstairs. And that's very useful to us as residents because we can see a comprehensive look at their care in terms of head and neck cancer. So right here behind me, we have our team workroom, and that's where a lot of the interprofessional collaboration happens. The radiation oncologist, hematology oncologist, and head and neck surgeons all sit there, and it allows us to discuss management options for patients, and we're able to learn from other specialties while we're managing patients. And here's an example of one of our patient rooms in the Tuscon Cancer Center, and this room is really great. Actually, our staff had a hand in designing the layout and how we wanted the chairs to function. So it really is optimally designed for an ENT head and neck surgeon to use. As you can see, we have a great scoping tower here, and this allows us to record scope exams and then actually access them from anywhere, which is very convenient for us. So state-of-the-art equipment, a great place to do learning and examine patients. And additionally, patients can stay in this one room, and then the head and neck surgeon will come in and see them, followed by the other subspecialties, as well as other collaborators such as speech pathology, social work. So it really is a great hub for patients to get center care in one place.
Hi, I'm Will. I'm one of the PGY 5 otolaryngology head and neck surgery residents, and I'm walking into the Glickman Atrium. This is a space between our heart hospital and our urologic institute. You can see Over on my left, we have quotes from the founders of the hospital, past presidents. The Cleveland Clinic was founded in 1921 by 4 physicians, Kreil, Bunce, Lauer, and Phillips. And they put down a ethos of patient care that we've perpetuated until now. Our motto is patients first, and that's reflected in all aspects of the organization and the structures. We can see behind me, we've got one of our pieces of art. This is a sculpture called Iceberg. It invokes the heart for a lot of our patients and a lot of our caregivers, but also represents what's below the surface. We just came from the Glickman lobby where you saw the iceberg sculpture, and one of my favorite things about working at the Cleveland Clinic is being surrounded by cool art all the time. Behind me you can see the giant pumpkin sculpture by Kusama, who's best known for her Infinity Mirrors exhibit. And this kind of stuff moves around the clinic. There are several full-time employees who curate and move the art collection around. You spend every day surrounded by these cool sculptures, and the patients, there's an entire ethos of the environment of health and the environment of care where patients feel like they're surrounded by beautiful things and feel like they're in a space that's well cared for. On a more practical note, the residents use it to get around the Cleveland Clinic because this place is huge and you need some kind of cue on where to turn left or right at any given point in time. Every once in a while they move the pictures and then you're in trouble for a few days.
My name is Sarah. I'm one of the PGY4s here. We're currently now in our Pediatric Outpatient Center. This is a new building that was just finished last year. It's where all of our pediatric services have been consolidated. And so this is where, as an intern, a PGY2 and a PGY4, you'll rotate on the pediatric ENT service. We do clinics here, including our multidisciplinary airway clinic, where you'll be working alongside the pediatric GI doctors, the pulmonologists, speech therapy, and social work for all of our complicated peds airway kids. In addition, we have outpatient surgeries that are done here, the more outpatient bread and butter tubes and tonsils that you'll do a lot of as a PGY2. Our main peds hospital is attached to our main hospital, and that's where we do more of our complicated, more involved pediatric surgeries. But you'll spend time here on your pediatrics rotation, and it's adorable here, and kids are wonderful. You guys.
Hi, my name is Malek and I'm one of the PGY1s. I'm going to show you around the House Staff Resource Center. So the first thing you'll notice is there's a lot of art on the walls. There's currently an art contest going on. So all the art that you see is being produced by residents, and there'll be a cash award at the end for whoever had the best voted on art project. Another thing that's really important about this area is there's free coffee. So a lot of times you'll come in here, grab a cup of coffee and head upstairs. All the custodial staff and the environmental staff are always cleaning up after us and always replacing that very frequently, so we're very thankful for that. We also have a lot of computer space in this area, so lots of different residents from different specialties will come to chart check on their patients or read up and write their notes at the end of the day or in the afternoon, and that's really important for us, so that's something that we use this a lot for. This place also houses some of our copiers and our printers that we use very frequently, which allow us to sort of make sure that we have adequate resources when we're rounding. And it also houses 5 big conference rooms that have a big TV and allow us to kind of get together in an interdisciplinary fashion to discuss patients, talk with other teams, etc. This is one of those conference rooms right now, and it's got a lot of space for all of us, as well as this TV as I was explaining to you, and so we use these very frequently. You'll have access to this area all 5 years of your residency here, but one of the times that you'll use it the most frequently is as an intern, where you'll be working with the general surgery folks as well as the anesthesia folks, and so they're mainly housed in this area, and you'll get to know them very well and develop some collaborative relationships.
We're now entering G81, which is where all of our otolaryngology patients are housed. It's a 30-bed wing on the 8th floor of the G building. It also includes our step-down unit. We have 8 step-down beds. Pretty much all of our free flap patients are coming here immediately, as opposed to necessarily going to the ICU as they once did. You can see these rooms. It's Christmas time essentially, so they're a little vacant, but right now all these cabinets, all the supplies that you would ever need, suction, etc., is ready for you in case of an airway emergency or anything else you might need. As we continue along G81, it's a good time to talk about some of the exceptional nursing care that we have supporting us. Our otolaryngology nurses know our patients just as well, if not better than we do. And we're very fortunate to be able to have them taking care of our patients. We're now entering some of our clinical workspace. You see some 50 residents hard at work. They would tell you that we not only have wonderful nurses, but also mid-levels, including nurse practitioners, PAs, that help manage some of the clinical volume. So you, as a prospective resident, would be able to focus on the things that are most educational to you and not necessarily doing all the clerical work that kind of can weigh down residency.
So we're now by our consult room here. Show you around. This is where we keep all of our supplies and equipment for any consults that we get in the hospital, and it's really nice to have this one place where we can keep anything we need, from suction tips to speculums. We have any of our nasal packing and airway supplies here. We usually have a cart for emergencies and airway emergencies as well. And we keep our various scopes in here as well that get cleaned on a regular basis. So this is really convenient for us, so we don't have to run around the hospital to get what we need.
On our final stop of the tour, we're going to be entering our resident offices. Here we're fortunate to have designated workspaces with computers for every resident. So we spend a lot of time just hanging out in here, relaxing, but we also do a fair bit of research, productive things as well. They're right adjacent to our staff offices, so we don't have to go far to talk about cases and the like. This concludes our tour. We are so glad that you were able to join us. We hope that you will join us in person in the very near future. We do love it here at the Cleveland Clinic, and we're sure you will too.